So a couple things about putting on an AFO for a child that has strong plantar flexion tone and pronation tendencies, like Michael here. A couple things just to show you. First of all, the AFO, one thing we have on the strap here is a little mark on this dorsal strap so that you can tell how tight to pull it when you put it on to make sure it's on tight enough. The other thing we have is a peek hole in the back here, which we'll be able to either feel with your pinky or look into to make sure the heel's all the way down in. So those are two things just to make sure that it's on correctly when you put it on. Now, as far as with Michael, what we want to do is it's always helpful to make sure that kids are sitting in a relaxed position and keeping the knee bent up towards the chest, so the hip and the knee are flexed, so the knee's coming up towards the chest generally helps these muscles to relax. And then what we want to do is just gently push up on the foot here and try to maintain neutral position. His tendency is to pronate, which externally rotates the foot this way. So if we bring it in this way, internally rotating the foot, then we can help keep these bones in the right position back here. And again, I'm going to bring his knee up towards his chest. There you go. And so what I'm going to do is come right up behind his leg here and kind of put this part up against his calf. Open up this padding down here and then lift up against his foot. Again, keeping the knee bent. And I'm using my own knee to rest on the heel. I'm just going to push his foot back in here. And turning it in can help keep those bones in the right position. So what we're talking about in an overpronated foot is the foot externally rotating on the leg, or depending on how you look at it, the leg internally rotating on the foot. And when you look at it from the back, you see this position here where the heel tips to the outside and the forefoot abducts, and the bones in the middle of the foot, the arch of the foot here, drop down to the floor. This sort of breaking apart of that joint. And so what we want to do as far as maintaining that correct position is use that rotation to our advantage. If the foot is stuck in an externally rotated position, what we're going to do is turn the leg internally. This would be a right foot. Turn the leg internally as far as it will go, so the knee joint is holding the tibia so that the tibia itself can't turn in anymore, and that allows us to better control the foot to get the foot down into the AFO. And this is going to tuck in like that. We'll pull our strap through, and we're going to look for that silver mark. Now I don't quite see it, which means this foot's probably not in all the way. So I'm just going to push him back a little further. And I'm squeezing right through here with my thumb while I'm doing that. And there we go. Okay, and then we have, so this has got to be tight enough to hold his heel down. This strap up at the top does not need to be real tight, but then I can feel right in the back here, and I can feel his heel right down in there, so I know it's good. And the last thing I want to do is pull the sock here and out here just to make sure there's no wrinkles under there, and then it should be all set. If you're interested in learning more about pediatric orthotic care and how to help children who are struggling with mobility, please check out our website, pediatricrehablab.com. I put together a course there both for parents and for medical providers to help them be able to help kids who are struggling. If your child or your patient is already working with pediatric orthotics, then you know that they can either be an enormous help or a daily painful struggle. And so I want to make sure that every parent and every medical provider has all of the information available in order to help their children the best way possible.